In this video, we'll be looking at the 7th generation combat application tourniquet by North American Rescue. Feel free to use the chapter markings or skip ahead to the timestamps. In the full guide, let's start off by looking at all the functional parts of the combat application tourniquet, otherwise referred to as the CAT. The CAT has a long self-adhering band. It's made up of hook and loop Velcro. It feeds through the self-rating buckle and can attach back onto itself. The windlass mechanism sits on top of a plastic mounting plate and consists of the windlass rod, which sits in the windlass clip once it's tightened. There's a white Velcro strap, which keeps the rod in the clip and doubles as a timestamp. To stage the CAT, take it out of its plastic wrapper, undo the hook and loop Velcro, and extend the self-adhering band fully to ensure the windlass mechanism has been reset. Now that we have the CAT staged, let's look at where we position it and how we place it on the patient. Once you've identified the bleeding site, place the CAT directly on the skin, not over clothing, about 5 to 7.5 centimeters proximal to the bleeding. Don't place the CAT over joint spaces, and if in doubt, go high, go tight. Let's look at a couple of views of us applying a CAT. When we place a CAT, put the windlass mounting plate in an area so that when the windlass mechanism is engaged, it's not impinged upon. A good rule of thumb is on top and lateral. Once you're happy with placement, route the self-adhering band through the buckle, pull and tighten, and secure the band onto itself with the hook and loop Velcro. Next, we perform the 3-finger test to ensure that the CAT is tight enough. We'll talk about this aspect later in the video. To engage the windlass mechanism, twist the windlass rod in either direction to tighten. Place the windlass rod in the clip when you think it's adequately tight. Check that the CAT has been tightened adequately by checking for the absence of bleeding and distal pulses. To secure the CAT, place the remainder of the self-adhering band through the windlass clip and over the windlass rod. Place the white restraining strap over the band and onto the windlass clip. It's here we can note the time of application. The 3-finger test is an important aspect of applying the CAT. It's noted by the manufacturer that without performing the 3-finger test, this is a leading cause of failure of the tourniquet. The tourniquet is adequately tight when 3 fingers cannot pass underneath the tourniquet. If this is the case, release the self-adhering band, retighten, then resecure. Then ensure that 3 fingers cannot pass underneath the tourniquet. If we take a closer look at the windlass mechanism, we see that the rod is attached to the self-adhering band in 2 places via this non-stretchable material. When the windlass mechanism is engaged, there's only a finite amount of tightening available, which is why it's important to do the 3-finger test and ensure the tourniquet is tight enough, and then when the windlass is engaged, bleeding can be stemmed. If after placing your CAT you have continued bleeding, check your tourniquet to see if you can engage the windlass mechanism any further. If, however, you're at maximal tightening, consider placing a second tourniquet adjacent and proximal to the first. In summary, the CAT can address critical bleeding in our patients. For it to do so, we need to make sure that we place it appropriately and apply correctly.